Good morning, everybody. Morning. Thank you for filling the house today. Great to see such a large crowd here. My name is Steve Brigham. I'm the facilitator of Creating Community Solutions. We're really excited today to be able to present to the mayor and all the district leaders our action plan that we've been working on for the last 4 months with 4 dozen people. And so without further ado, I'd like to ask the mayor to come up and give some opening comments and get us going.
Thank you all very much, and good morning, everyone. I want to thank everybody for being here this morning and for your participation in this effort. How many people were at the kickoff for this event back in October over at the convention center? You know, it was really uplifting to walk in there and see so many people. I don't know how many were there. It must have been 350, 400 people who were there. To see so many people who were interested in such an important issue, taking the president's charge and, you know, doing it as we uniquely do here in the District of Columbia, and that is moving aggressively forward in the planning for how we're going to address in a constructive way the mental health challenges that face people in our city. I'm delighted that we have so many of our leaders here today. You will have a chance to hear from them. I want to thank Steve Barron, of course, who is the director of our Department of Behavioral Health. Steve has been for a number of years now the director of mental health in the city. And just a few months ago, we made the decision to bring our substance abuse programs together with our mental health programs, recognizing that the co-occurrence of those two difficult conditions is far more prevalent than people realize. I don't know, maybe 30, 40% of co-occurrence. So it just made sense to bring them together, and it made sense also to tap someone who really has done extraordinary work in the city to be able to lead that effort. Some of you may know that I think the longest standing court case in the history of the District of Columbia, maybe the world, was the was the Dixon case. You know, that case had been around so long that it preceded home rule. That's how long-standing it was, and you know, we now have worked our way out of it. We've been out now for about, what, a year and a half? Almost 2 years. Almost 2 years. Yeah, 2 years. We've been out of that. So what a phenomenal accomplishment for the city. Not just to get out of a court order, but to have someone say, you have met the requirements of that order to really establish, importantly, a community-based mental health program in the city. Because back when that order was issued, there wasn't much of a community program. There was St. Elizabeth's, which was run by the federal government, run by NIMH at the time. And I think at its peak, I think St. Elizabeth's had 7,000 people who were there on both sides of the avenue. Now we have a robust mental health program in the community. Obviously, we still have our challenges because one need only look at the mental health challenges extant in our homeless population to see that we continue to have those challenges. But we have really come light years, and I think one of the symbols of that was the being able to move out from under the Dixon order. So what we're doing now is a strong statement. So Steve, thank you for what you do. I know we're going to hear from you just shortly. And I want to recognize our Deputy Mayor for Health and Human Services, Bibi Otero, is here. Our Deputy Mayor for Education, Abigail Smith. Our Chancellor, Kaya Henderson, who is here. Our Director of Health, Joxel Garcia, who is here. And the State Superintendent. What a great title. State Superintendent of Education, Jesus Aguirre. And we have you representing Paul today? Okay. Anyway, our Deputy Mayor for Public Safety and Justice is represented here today as well as the Children and Youth and Investment Trust Corporation. Thank you, Mark.
Pardon me, sir.
Yeah. Is it coincidental that you put that up there as soon as I finished? No. Anyway, we're glad, too, that we've got the media and so many people who come out for this. Again, I was delighted to be able to participate in the summit back in October. I participated a couple of weeks ago as we started to culminate the planning effort on a Saturday morning, and Even though it was a Saturday morning, it was not very good weather. Again, the room was filled with people to come out and be a part of that. I want to thank all the community action planning members who have worked to be able to make this happen. And I want to thank a couple of organizations who have stepped up to allow us to continue with this. I want to thank Care First, who's represented today by Tanya Kinlow, who works very closely with us. They have contributed $25,000 to be able to help us continue with this effort. And then the Children's Hospital National Medical Center, represented Dr. Newman is not able to be with us today, but Lee Beers is here. So I want to thank Lee for also $25,000. So that will allow us to continue, and I think even more, I won't say more than, the dollars always mean a lot, but in addition to the contribution of financial contribution, it's an important statement of the worth of this effort, and we really appreciate that from two hugely respected organizations in this city to underscore the importance of continuing to do this. So, you know, we're trying to do as much as we can to invest in children in the District of Columbia. That's why it's so important to have here who we have here today. We obviously are doing as much as we can to invest in education. And, of course, for anybody that will listen to me, I will talk to you until you get up and walk away about early childhood education. I was in a classroom the other day. The Chancellor and I were at Powell Elementary School, where President Obama was. And he was there because he wanted to see an early childhood education program in the District of Columbia, which I have also said to anybody that will listen, they have called a model for the nation. And isn't it great to be a model for the nation, ladies and gentlemen, right here in the President's backyard? And, you know, it was not only wonderful to see these young people demonstrating what they are learning, you know, learning to read, learning to grasp arithmetical concepts. But what was really pronounced was the socialization that was taking place in that classroom. Watching these young people learn how to behave in a civil manner and to respect one another and relate to one another. And those are the qualities and skills that will carry them forward in ways that they otherwise wouldn't have. So it is truly uplifting, and this is yet a continuation of it. And I really believe those experiences, Steve, will benefit our efforts around youth mental health efforts as well. So with that having been said, I want to introduce Steve Barron, who's going to give you a little bit more background on the initiative itself. We will hear where we are with the plan, and then we will come back a little bit later. So please welcome our Director of the Department of Behavioral Health, Steve Barron.
Thank you, Mr. Mayor. I love softballs. That's great. And thank the mayor. I mean, the mayor's participation and leadership in this whole initiative has been instrumental. October 12th would not have happened without the mayor lending his expertise, leadership, energy, and most important, his passion for these issues. We saw it on October 12th. We saw it on February 22nd, that Saturday meeting. We see it all the time, how strongly committed the mayor is to children and children's mental health. So thank you, Mr. Mayor. Okay, it's my pleasure to give you just a brief orientation of what brought us to this moment, and then we're going to hear from the members of the Action Planning Committee. I had the pleasure in June of being invited to the White House meeting, and that's when President Obama, Vice President Biden convened this meeting of about 150 people to focus on the mental health needs of young adults. It was an extremely impressive gathering and an impressive day, and there was a challenge to the country to go out, deal with your communities, how to better get people in care and access care. And we had tremendous presentations, the role of social media, which you'll hear about more today, and other things. But that challenged us. We in the district, and we want to thank Steve Brigham, who you met at the beginning, and his leadership, and the America Speaks at that point, who helped pull us together. And our friends from SAMHSA, who you'll hear more about in a little bit. So thank you. So it was a wonderful day. There were 3 goals talked about for the national dialogue: to get people talking about mental health, to break down stigma or barriers to treatment, to identify innovative community solutions, and for communities to develop clear action steps to build upon existing local work. At our summit in October 12th, more than 400 residents attended and set 12 priorities for youth. They were broken down into 2 groups: youth 12 to 17, of which there were 7, and 5 for youth 18 to 24. You can see that from the list here that the focus on the younger group encouraged youth to talk and to focus earlier than age 12, and you'll hear about some of the projects we have, and to overcome resistance to treatment. For the older youth, which we refer to as transitional age youth, or TAY, and it's a little bit of a flexible age definition, but usually 18 to 24, sometimes 16 to 24. The priorities were a little different. They focused largely on the many needs that youth in that age band have to achieve economic independence. And you'll hear from our work reflecting that. After the summit, we constructed an action planning team that was about 50 people that invited stakeholders from a wide range of sectors in the district, both inside and outside of government. And I want to emphasize this. This is not an effort that's just a governmental effort, and we saw that through our action planning group. It's inside and outside government. And they're based on the 12 priorities. 5 work teams were formed that focused on, as you can see here, early identification and prevention, community awareness to reduce stigma, youth-to-youth engagement, mental health curricula and programs, and supporting transitional age youth. These teams have been done extraordinary work over the past 4 months, honoring the priorities from the summit and translating them into actionable initiatives and recommendations. And there was another challenge. There's a lot of great work going on in the district, and how to make this action plan fit in and coordinate and really enhance what's going on, and not to create this parallel play. So that was their work, and we're excited to have members of the team to provide highlights of their work over the next 25 minutes. Our presenters are going to be, for early identification and prevention, Susan Fleischman, who works at the Mary Center; community awareness, Kimberly Johnson, who works for us at DBH; youth-to-youth engagement, Rebecca Renard, who works for the DC Youth Investment Trust; mental health curricula, Dr. Marlena Banks, who works for DBH; and transitional age youth, Lisa Albee, DBH. So I'm going to ask Susan to come up from Mary Center to kick off with her review of the early identification and prevention. So Susan, you're on. Thank you.
Great. Thank you, Steve. Steve Brigham to the rescue. Okay. Thank you very much. I'm honored to be here this morning. My name is Susan Fleischman. I'm the Director of Mental Health at Mary Center. And I'm here to bring the recommendations of our work group to identify early prevention and mental health, behavioral health problems in the district, especially for children under 12. One of the priorities that came out of October 12 said that 12 to 17 is a little too late, and there was an urge to start early. Why does this matter? Our work group exists because of the recognition that behavioral health issues don't suddenly arise at age 12, 14, or 16. These issues have often been going on for years unaddressed. By the time the child is a teen, these issues can result in school expulsion, criminal involvement, truancy, dropping out, and a host of other events. And in turn, this results in significant costs in multiple sectors, as well as adult futures that do not look bright. This does not have to happen. Our work group, which represents many service sectors, school, primary care settings, public and private mental health services, have seen example after example where children's lives have changed for good when a caring and informed adult noticed a child's behavioral health difficulties. They first assessed exactly what was happening, then asked why, and then came up with a plan to address it. Thank you. I'm shorter than the average speaker. Okay. This happens with our medical providers all the time. Even though mental health parity passed in 2008, we are still far from the goal that mental health is normalized, discussed, and addressed. Why is this? We believe because professionals, lay people, and children lack a common, basic understanding of mental health and a language to discuss it, and our recommendations are as follows. Our group first looked at already existing DC initiatives in the city to address this issue. We urge city leaders to fully support the two main initiatives currently underway: the DC Collaborative for Mental Health and Primary Care, which is working to assist primary care providers to screen for and address behavioral health issues in children, and the Blueprint for School Mental Health, which is working to create systems in schools to meet the behavioral needs of children. These perfectly align with our work group's aims. Next, our work group proposes 3 policy recommendations which expand on already existing activities in the district. Policy recommendation 1. Expand the capacity of DBH's Access Helpline to provide consultation on early child behavioral health. Currently, there is no place in the district to call in and talk out concerns and receive informed guidance around children experiencing mental health problems. The Access Helpline is well positioned to fill this need. Policy recommendation 2. Utilize interactive media so the public can access information and referral services for young children. But make it interactive. Phone apps and live chats are examples of the kinds of social media that other cities are moving to, and we urge Washington to also move toward. Policy recommendation 3. Expand the capacity of the integrated electronic system that is underway under Systems of Care grant to include services beyond DBH providers. And finally, the real meat of our work group's recommendations are the following initiatives. Establish and require compliance with minimum training standards for all youth providers. This would be analogous to requirements that all health providers receive CPR and first aid. Currently, DBH offers mental health first aid, and this has been a very needed and successful initiative, but the demand has surpassed the capacity. We recommend building a training infrastructure to ensure that any provider who touches the lives of children receive basic training on how to recognize and address early signs of behavioral health problems. Secondly, we need to ensure that these trainings include modules on how to recognize signs and symptoms in children under 12, as these signs show differently in the young ones and are life-changing when recognized early. And finally, we recommend a broadly focused public mental health campaign to standardize messaging and normalize the concept of mental health and emerging mental health problems in young children. Such a campaign would enlist celebrity endorsements and would also use common, everyday words and visuals to create easily understood and destigmatizing messages. Words like too sad, too mad, too afraid, and associated images like those used in the pediatric symptom checklist. Here are just 3 examples from the pediatric symptom checklist that pediatricians are currently using, but also providers in schools. This simple behavioral health screen gives the opportunity to mark never, sometimes, or often, which really helps get at the difficulties that young children are experiencing and give a simple language. As you can see, the public health world has demonstrated for us many successful campaigns that produce very accessible knowledge that save lives and suffering and dollars. Stop, drop, and roll, the food pyramid. We can do the same with mental health, and we believe that the time is now. Thank you. So just a moment to introduce our next speaker. Stigma is a huge stumbling block on the topic of increasing mental health awareness, and Kimberly Johnson will focus on this in her next presentation.
Good morning. I think you can begin to see how these plans easily transition from one to the other. So now that you've heard from the early identification team, the community awareness team would like to share the plan for our campaign. We were charged with the task of reducing stigma and stigma associated with mental health and persons with mental health needs. Since research supports that most of the stigma surrounding mental health doesn't lie with youth, but is actually transferred to youth from adults who've already formulated their belief system, we wanted to find a way for youth to drive our anti-stigma campaign. If you've ever been on Facebook, Twitter, or received a text message on your cell phone, chances are you've used cyber slang at some point. Although widely used by adults, most abbreviations like LOL, OMG, and SMH were organically created by youth. Amazingly, young people have and create their own language. If they can make SMH mean shaking my head, then they can also change it to mean support mental health. The Mixed Media Campaign to Contest asked district youth to turn a phrase with a negative connotation into a positive expression about mental health by creating a poem, a poster, a video, or a public service announcement. The winner of the contest has the opportunity to see their artwork used as the creative concept behind a full-fledged ad campaign. These are some of the channels that we're planning to use, some of which are already on board, some of the messaging and agencies that we want to use for distribution. We plan to implement traditional media outlets, social media, and social marketing. So here's what we know about youth. They have the ability to influence adults. They also listen to each other and are accountable to each other and are often used to police one another when adults are not available. They can still develop healthy attitudes about mental health because they haven't already decided what they believe. Their belief system is still being formed. Youth also learn best when they're having fun and engaged in some type of activity. And here's what we know about successful anti-stigma campaigns. They educate and create awareness. They inspire conversation, which is crucial to dispelling stigma, since we need to get what we believe in our head out into an open and well-informed discussion. Anti-stigma campaigns also provoke a shift in one's attitudes and beliefs, and they turn a negative into a positive. You might be asking, if there are so many successful anti-stigma campaigns, why are we reinventing the wheel? Well, we're not. We're just asking the youth to drive the car this time. You see, none of these campaigns reflected here are driven by or targeting youth. So the community awareness team combined the best of both worlds and the best practices of each concept in order to engage youth in the strategies to develop this plan. We were also one of the few teams who actually had 2 youth members participate in the formation of our plan. We used them to get us the most recent word on the street about what was acceptable in order to implement it into the campaign. Within the plan itself, when you have an opportunity to read it, you'll find the contest description, rules on judging, social marketing, guidelines for participants, and a budget for a pilot launch. You'll also see that the plan is scalable and ready for immediate implementation. The contest was designed to be an annual event which will increase the number of participants each year. We believe once the district's youth-serving organizations become involved, people will begin to associate mental health with a fun and positive experience. When these efforts are sustained over time, a reduction in stigma should result. Thank you for your support. And so in terms of youth engagement, I want to introduce my colleague, Rebecca Renard, and you'll begin to see how these issues connect. So in terms of how we engage youth for the campaign, she's going to take it even to the next level with her youth engagement plan. Rebecca Renard.
Thanks, Kimberly. Good morning. So as Kimberly mentioned, there's a lot of kind of parallels or connections between the anti-stigma campaign and the youth engagement teams. We were the other team that had youth participants on our committee. So in terms of youth engagement, this initiative really stems from a lot of the comments that the young people on October 12th gave about the need to have safe spaces for them to talk about mental health, how there's not really the space for them to dialogue about it. They don't feel supported by adults when they do talk about it. And so this one posits young people as the agents of change and the empowered center of the initiative. So the initiative might sound kind of simple, but it's actually very, very powerful. So essentially, young people with lived experience, and I put lived experience in quotation marks because lived experience doesn't have to be a diagnosed mental health challenge, because we've all had some mental health issues. I know I have. And so it could be, grief from the loss of a loved one, or it could be a bad breakup. However a young person defines a mental health challenge is really what we're looking at when we talk about lived experience. So these young people with lived experience are empowered to create safe spaces and facilitate conversations with other youth about life issues. And again, I put life issues in quotes because no young person is going to come to a table to talk about mental health issues. Like, that's just not, like, I wouldn't even go to talk, well, maybe I would. But no young person is going to do that. So we're creating safe spaces for you to talk about life issues in general. And as young people talk about these different life issues, whatever they are, the space is created for them to, as Kimberly said, to police each other, or to not necessarily police each other, but to offer experience from their own lives. I tried that, didn't really work out for me, or you might want to think about this thing. So young people are very good about sharing that when they feel comfortable in their spaces. So as these different issues come up, the youth facilitators are empowered to be able to connect youth to resources as needed. So the space could be an informal space for each other, for the youth to support each other, but it also serves, and with the support and training that the youth facilitators get, it serves as a really critical first referral point to other more formal supports. And then it also encourages young people to advocate for themselves and to advocate for talking about their own health issues. So in terms of the outcomes of this initiative, first we want to see an increase in the number of young people trained and engaged as peer mentors and facilitators. And this continues a conversation that we've been having more and more of in the city, of really positing young people in the position as leaders, really utilizing their expertise and where they are to help and benefit each other in the community. The second outcome is to expand the kinds of opportunities for youth to discuss these critical life issues. So again, this was one of the key points that came up in the October 12th session, is that there's just not the number of spaces that young people need. The third outcome is to expand the number and kinds of spaces where young people feel supported and able to talk. So it's a little bit different from the first, from the second bullet. And when we say the number and different kinds of spaces, we want to make sure that all of these spaces don't look the same. Because some youth are very program averse. They're not going to go to a formal program to discuss something. So we need to really diversify the kinds of spaces where young people feel supported and able to talk. Continuing with this conversation about destigmatization, one of the other outcomes is to gradually remove the stigma of mental health and behavioral issues. So they're really talking about and becoming comfortable talking about their stuff. And then the last piece is to increase the connection of youth in need to resources for healthy development and well-being. So those are some of the larger outcomes of this. So how are we going to do this? In our plan, we're researching local and national best practices that we're going to codify. So there's not a whole lot of work being done in this specific space, but there is a lot of great work being done in terms of peer-to-peer outreach and education, especially in the sexual health realm, especially in the HIV realm. So we're going to cull all of that best practice, put it into, and codify it and put it into a proposal, request for proposals for grantee organizations to then be funded to create programs that use those best practices towards this focus. So again, there might be an organization that actually does this work in DC. There might be an organization that does similar work but can expand the work or can broaden the scope of the work. The grantee organizations are then responsible because the community-based organizations have the expertise in youth development. They have the staff who are really good with working directly with young people. They have connections to communities that are really essential. So the grantee organizations, using the best practices that have been identified, develop the program, identify the young people, or the young people can identify themselves and be connected to the organization. The organization trains those facilitators and then supports the youth facilitators through their process, through the grant cycle and through the facilitation process. And then the youth facilitators are the ones who actually connect with the youth in these different spaces and refer them as needed to more formal supports. So we put a list up here of key organizations and roles that might be a part of this. So the DC Children and Youth Investment Trust is actually going to be the home institution or the home of this initiative. And we are going to fund. We have some dedicated funding to this already because it's such an essential piece of this picture. we will put together a team of other subject matter experts to develop the RFP, because there's so much expertise within the community-based mental health space, within the Department of Behavioral Health, with youth themselves, that can help craft the RFP to make sure that we're meeting all of the eligibility criteria that need to be met by organizations, to ensure, again, that those best practices are reflective of what really is working in the space. The Department of Behavioral Health serves on that subject matter expert team, and also serves as a key resource for those funded community-based organizations, so that they can get the young people connected to the supports they need. Community-based mental health service providers also provide subject matter experts, and they're probably going to be the key linkages directly to the young people, because DBH doesn't necessarily have that capacity in-house, but funds and works with other organizations that do have that expertise and are embedded in the community as well. We have adult mentors from community-based organizations that serve as the key supports for the youth facilitators. So again, it's not just putting young people out there in the world and asking them to do things. The young people, the critical piece is the young people are connected to a larger organization that serves as a support for them as they go through the facilitation process, and again, to connect them to other resources. Youth, obviously, are a key agent of change in this, so the youth facilitators and the youth participants are an important piece. And then this last bullet, the community spaces. So going back to that idea that young people could be program averse, we want to make sure that we're doing this in both traditional spaces and non-traditional spaces. So traditional spaces could be community-based organizations. They could be public libraries. They could be Department of Parks and Recreation spaces. But they could also be barbershops. They could be spaces in the community, the carry-out. It could be the Chipotle down the street where young people feel comfortable being and engaging. And so we're really trying to give young people the power to define what space they want to have these conversations in. And then, again, kind of connecting to the broader work. This work does not exist in a vacuum, and I think that's really, really important to identify. There are a couple of other youth outreach initiatives that are being built right now or that are already on the ground. So I know that the Department of Behavioral Health, along with the Trust and the One City Youth Initiative, are creating the certified peer-to-peer outreach program that will also be working with Total Family Care Coalition on. So this is a very formalized approach to kind of the same thing. Young people with lived experience being trained as certified peer facilitators that's Medicaid billable to help young people with mental health issues be able to navigate those issues. It connects to the youth outreach coordinators piece of the One City Youth Initiative, young people, or young adults rather, who are embedded in our core neighborhoods, who are acting as liaisons to other youth in those neighborhoods. It connects to the re-engagement center work that's coming out of RAISE DC and the Deputy Mayor for Education's office and the Truancy Task Force. Again, leveraging all of these different points of contact for youth, especially disconnected youth who might have needs that aren't being addressed. And then finally, the Roving Leaders Program with the Department of Parks and Recreation, which again has adults and young people increasingly who are empowered and who have really strong relationships with youth in the communities. So it leverages the strengths of all these other initiatives, brings them together to serve as supports for each other so that young people can successfully navigate their own mental health. And with that, I would like to pass it on to Milena Banks, who's going to talk about mental health curriculum and programs. So, Milena.
Good morning, Jen. So just as Kimberly was saying earlier, some of our plans just kind of go together. So as they engage the youth in one particular initiative, our initiative is then, once we get them in a safe space, to go ahead and educate. So who are we targeting here in this community? The community are youth, family, caregivers, anybody who has any contact with youth, including first responders. Why is this so important, education? Education can decrease barriers and it can break down stigmas. Let me give you an example. I know we're all fairly young in here, but if you can, think back about 20 to 25 years ago when we first, if you can, I know it's a stretch. When we first started to talk about HIV/AIDS, right, there was a way in which people thought that you could catch AIDS, right, through sharing utensils, through kissing and toilet seats. Fast forward to the present, we know that that is not the case at all. So we want mental health to be that way. We want to get back to the basics, to understand that mental health is just about expanding your knowledge about mental health so that we can decrease that stigma. So in the first initiative, like I said, was getting back to the basics, the 101 really of mental health, if you will. So in this objective, we really want to have the community be able to define what mental health is. to understand that things are normal. To have a bad day and a sad day is okay. And then also understand that when things are abnormal, when you're sad or upset for days on end, and understand that there are various ways to treat mental health, that you can actually get well, you can recover, using people with lived experience, youth with lived experience, to kind of give their way in which they were able to recover in ways that they were able to get well. So that brings us into our second initiative. Our second initiative is about planning. So now that you understand that you have a mental health disorder or that you have a mental health challenge, what do you do if you're in a crisis? It's kind of like thinking about a fire drill. So everybody knows that in a fire, you're supposed to take the stairs and not the elevator, right? They also know that you're supposed to, walk and not run. You're supposed to, do these certain things. So we already have been working on this plan since we've been in school. So the same thing about when you're in a mental health crisis, you need to have a plan in place. So the first part of the plan would be to have prevention. So understanding what triggers are when you're in a mental health challenge. Once you understand those triggers, then doing things to help cope with them, workable kind of stress options to be able to cope with those stressors. And then if the coping strategies you feel like are not working, being able to understand that there is something that you can do for immediate action. So being for the community to understand that there are referrals that you can place with things like Access Helpline. So having the youth to understand that is very important. So how will we be able to do this? So of course we want to house this underneath the Department of Behavioral Health because they're doing a lot of great things already in this. We just want to really expand that and really meet the youth where they are in these safe spaces. Wherever the youth are, that's where we want to be giving this education and inviting families and, again, first responders. And a more budget-friendly is using the train-the-trainer model. So we have a lot of expertise already in the Department of Behavioral Health, mental health providers, to be able to give this knowledge and really work with this initiative and work with this plan to be able to educate the youth. So again, we have some of the programs already, such as mental health first aid, youth mental health crusade. We already have first responders, such as crisis intervention officers, but we need more of them to be able to go out and work with the youth and have them to understand mental health awareness and plan for when if something, they have a challenge or anything like that. So that is our two initiatives. And next up, we're talking about transition age youth with Lisa Arbery.
Okay, so transitional age youth, how can we make a difference? Here, this slide shows that our purpose of our work group. We had 4 goals to figure out what tailored services these transitional age youth need, to create supported employment programs, and to look at affordable housing and access to health care. I want to tell you a story because what's most important is that we understand our transitional age youth. Sean is a 19-year-old African-American male who previously attended Ballou High School. Sean was a star athlete on the football team, breaking the school's record of most passing yards. Sean was a charming student who attended school and appeared to have a bright future in higher education and a professional career. Tragically, Sean's older brother was killed in a motorcycle accident during Sean's junior year at Ballou. Sean's loss truly impacted him. He dropped out of high school and began smoking marijuana and hanging in the streets and has been arrested for petty theft. While Sean continues to have his own set of issues, he finds time to care and support for his mother, who has been suffering from depression since the loss of her son. Sean still loves football and misses his interaction with his team and coaches. Sean desires to return to the field in some way someday. He also thinks about his long-term dream of being a physical therapist. This is our transitional age youth. And we see that they are really at a stage in life where they are trying to transition into adult roles, and they need support to do that. We see that common challenges among the whole group of transitional age youth with emotional and behavioral difficulties lead to things like higher secondary school dropout rates, higher unemployment, higher rates of arrest and incarceration, lower rates of independent living, and greater dependency on social services. We know that transitional age youth are our future, and we don't want these outcomes. Our recommendations include creating a system of care for transitional age youth. This would build on some of the initiatives such as the One City and our supportive employment programs and our Transition to Independence program. In addition, we want to improve our access to care for transitional age youth. We need to get the information to them in a streamlined way. We want to do that by enhancing our customer service through the Access Helpline and upgrading our Access Helpline. Our next policy recommendations are in regards to increasing economic independence. We already have a program called the Transition to Independence Process, which was rolled out last year, and we want to look at this program and dedicate funding to this program so that we can sustain this program. From that model, we also want to look at other evidence-based practices that are engaging and meet transitional age youth where they are and bring those practices to the district. Our third recommendation has to do with housing, and overall here we just need to make the transitional age youth a priority population. We need to add them to our Department of Behavioral Health housing application, and most importantly we need to create a continuum of housing options that will give support to these youth. These youth need to learn how to live in the community with neighbors. They need to learn how to pay their bills on time. They need to learn how to take care of their apartments. So let's create some supportive and programs that will help them move toward greater independence. And lastly, we want to make sure that as we look at transitional age youth, we know that many of them have significant mental health challenges, and we need to develop programs for housing to support those youth with mental health challenges. Next, we want to increase their ability to be independent, and we need to create jobs. We need to have partnerships through DBH, DOES, and RSA to create jobs that start on a summertime basis and go into a year-long and ongoing basis. In addition, we need to mandate our government contractors to designate slots and jobs for our transitional age youth that are mandatory for that age group. Lastly, and very, very importantly, we are recommending that we educate our transitional age youth on health care, affordable health care. It is out there, and there has been some creative ways that we have reached out to the transitional age youth, and we need to bolster those opportunities and get the information to them so that they can have affordable health care. Thank you.
Thank you for great presentations. I just want I want to acknowledge all 5 teams, but I want everybody who is a member of any one of the 5 action teams, could you please stand? I'd just like to recognize. Thank you. Thank you all very much. Thank you. Before I turn the podium back to the mayor, we're going to be wrapping up very, very shortly. I just want to make a few remarks. It needs to be said, this is the first time that I know of that the district had a fully community-driven plan for mental health. So I really want to acknowledge all of you and all the great work that's happened. It's quite an achievement. The work before us in the next couple months is going to be ongoing. We thank our funding partners, Care First and Children's Medical Center. You helped make it possible, so thank you again. The executive committee, we're going to work to finalize all the appropriate follow-up where these plans belong, how we build on all this great work. We're going to continue to collaborate on securing resources so they can become a reality. I want to thank Ed Davies and Rebecca for their initial contribution on the youth engagement. Greatly appreciated. And finally, we're going to be hearing from SAMHSA, from Connor, from SAMHSA very, very shortly, that we're hoping that since they have helped instrumental in working with the White House, there could be some federal funding opportunities coming out. We're looking forward to. Thank you. So I didn't see the head go this way. So, Mr. Mayor, there's a lot of work to be done from planning and to implementation, but we're very optimistic that a lot of the work can move forward, particularly under your leadership. So thank you very much.
Well, I want to also thank the teams that came together. Weren't those impressive presentations that were made? Absolutely. I'm going to make this mercifully brief so that we can move on to the next presenters. But I hope that, those who haven't read the report will read it. It is quite enlightening. And, the 5 areas that were focused on, prevention and early identification, that's axiomatic, isn't it? And I think we know that there's so many entry points at which we can do something with that. With Dr. Garcia, we've talked a lot about infant mortality, and frankly, it's an opportunity even working on that to intervene with some of these concepts that were discussed today with young parents and then with very young children very soon after they are born. Addressing the issue of stigma. Stigma has been around since the beginning of the concept of mental health. And it was nice to be able to transition from the term mental illness to mental health. It's a much more positive approach to the issue. Youth engagement, creating mental health curricula that focus on how we take the knowledge that we have and translate it into opportunities for folks. And then I thought the presentation about transitional age youth, TAY, was hugely important, because that is a period when I used to be the director of Covenant House, and we referred to the folks that we worked with as too old to be children, too young to be adults. They were in the developmental twilight zone. And that's exactly what I think we see with so many transitional age youth. So I want to thank Steve Brigham for having led, as he's led so many times, a very constructive process. I want to thank again Steve Barron and his team for having gotten us to this point. And again, I want to thank the President for having put the charge in front of everybody to do this, and the charge has been grabbed by, our folks here in the District of Columbia. I think it underscores also something that we're doing, and we need to redouble our efforts, and that is to introduce wraparound services into our schools. That schools are places for education, but so much of education, as we know, is impeded in the classroom by some of the other things that happen to children, some of the behaviors that they demonstrate. And those wraparound services in terms of health, in terms of mental health interventions, can change educational outcomes for children as well. Again, integration of services is an overworked term, often misunderstood term, but frankly, it has an enormous significance for what it is that we are doing today. If nothing else, if we can take these 5 areas that we talked about and integrate them into what we do in our educational programs, our children will be far the better for it. So thank you all very much for coming. Somebody asked me how was my time. I said, you don't have to worry about me. I'm very interested in this. For those who don't know, my background is in human services, and my background more specifically is in clinical psychology. So if this had gone on for another hour, I would have sat here and done this, because I'm not sure there's a whole lot more important things at this stage. So thank all of you for coming today. And I think we're going to hear from Dr. Beers at this point. Dr. Beers.
Good morning, everyone. I also promised to stay brief. I know everyone's on a schedule today. But first, on behalf of Children's National and our president and CEO, Dr. Newman, who unfortunately is traveling and can't be here today, I really want to thank you, Mayor Gray, Deputy Mayor Otero, and Director Barron, for your vision and leadership, as D.C. was called to be one of the 6 lead cities across the nation as part of President Obama's National Dialogue on Mental Health. And as a pediatrician, I learn from children all the time, right? And so I also really want to particularly commend you for your strong commitment to involving youth in the planning process. I don't know how many of you know this, but at the almost a quarter of the 400 participants at October's Creating Community Solutions Citywide discussion were ages 14 to 18, which is incredible. I mean, what a testament to the power and the strength of our youth voice. Children's National is also very proud to be part of the action planning team, and we really applaud the tremendous and collaborative work that you just heard about today. Improving the quality of and access to mental health care is one of Children's National's key priorities. As we know all too well, and everyone sees day to day in their jobs, mental health concerns are really alarmingly common, and when they're untreated, they lead to devastating results for children, families, and their community. And early identification and treatment of these concerns, as you've mentioned, the Mayor, and others have mentioned through the day, are really key strategies in helping children and their families achieve their potential and their best outcomes. Unfortunately, the lack of child mental health providers, the complexity of the system, and other barriers that families face make this much easier said than done. But I really want to highlight some successes here, and Director Barron mentioned this. By working together through strong public and private partnerships, DC has made remarkable strides over the past years, and I think this is something that we should all be very proud of. One area where I work a lot, and where our city's made very impressive progress, is in integrating behavioral health care supports into what are called natural settings, so settings where primary care settings or schools. And these are places where children and families have very frequent and regular contact with trusted adults. And it's a piece of the puzzle, but it's a very important place to identify concerns early and ensure children and families get the care they need. So in medicine, we learn a lot by case studies. So I'm going to share an example and highlight one of these strong and collaborative partnerships that I've been very involved with, the DC Collaborative for Mental Health and Pediatric Primary Care. So, and I speak honestly when I tell you I think that the important progress that this team has made over really a very short period of time is a testament to the real value and effectiveness of the nonprofit and the government teams working together closely and collaboratively. The partnership was started a little over a year ago by a small group of really committed healthcare providers, advocates, and government representatives who just said to themselves, we can do this better, and we came together to see how we could do it better. Today, our key members involve many in this room, Children's Law Center, Children's National, DC chapter of the American Academy of Pediatrics, DC Department of Behavioral Health, DC Department of Health, and the DC Department of Healthcare Finance, and Georgetown University. We're guided by a multidisciplinary community advisory board of almost 50 members, including parents and representatives from government agencies, local and national nonprofits, and healthcare organizations. So recognizing the importance of such a very multifaceted and multidisciplinary approach, our overall mission is to improve the integration of mental health into pediatric primary care for children in DC. And we're very committed to addressing the mental health needs of diverse children and their families through culturally competent and family-focused initiatives. So just as a little taste of some of the things that we've done in the past year, we are in the process of planning for a mental health consultation program for pediatric primary care providers to help them better manage concerns that they see in their office. And just last month, we launched a 9-month training program designed to increase the rates of screening for mental health concerns in pediatric primary care at well visits. We've enrolled providers from every major pediatric clinic in DC, representing over 80% of the children enrolled in Medicaid in DC. So I think that's a huge accomplishment, and we're in the midst of it, and I'll keep you posted. But really, and this is a place where I've been spending a lot of time, and I can tell you with all honesty that none of this would have occurred without the really strong partnerships between the government and nonprofit agencies. You know, working together, building on each other's skills, each other's knowledge of the content and the processes, we've made remarkable progress in a very short time, and none of it really could have happened without the unique contributions of everybody on the team. Yeah, we've drawn on the strength of every partner and every agency, and I'm excited to see where it goes next. So again, I'll close. Children's is really very proud to be a part of this and other partnerships. We're very excited to see where the next steps take us. We look forward to continuing to work together with all of you. And again, thank you to Mayor Gray and your amazing team that you have put together here for your leadership in this area.
Finally, I'd like to welcome Kana Enomoto, who is the Principal Deputy Administrator for SAMHSA, an acronym I didn't know until I started this project, which is the Substance Abuse and Mental Health Administration. But we're really delighted to have your representation here today, because SAMHSA has really taken a major lead on this effort nationally, has been involved with many, many communities around the country. So thank you for joining us today.
Well, Steve, I do come bearing gifts, but it's not a check. Sorry to say that. But this is to the mayor. This is a life-size poster of mental health in my community. They didn't even give me one of these. You're the first one to get it. But this is in recognition of DC being really on the leading edge of hosting one of these national dialogue events. Thank you so much. When the president, I think even as the vice president made the announcement, as now is the time, you guys were expressing interest before we even knew what we were doing. And so DC was one of the first 9 cities. There's now been about 90 cities and another 40 to go. So thank you so much for being part of this. I'd like to give this to you. I am so impressed by both what you already have together in DC and what you are planning to do, and how you have done this comprehensive, community-driven, youth-centered process, which is so fantastic and really, again, a model for the nation. The recommendations you have seem on spot. They're very aligned with what we're seeing coming out of other cities who are engaged in this process, and also very aligned with the President's plan from Now is the Time. In January of last year, the Vice President and the President rolled out the Now is the Time plan to reduce gun violence and increase access to mental health services. And earlier this year, the Congress actually appropriated many of the funds, particularly for SAMHSA, $130 million for the Now is the Time plan. We're excited also to be working with our partners at Department of Justice and Department of Education. And so I'm going to describe to you a few of the initiatives we have, both part of Now is the Time as well as other SAMHSA programming that is very relevant to the pieces of the plan that you just described today. So starting at the earliest end of things, Project Launch. That's our early childhood initiative. And we are going to have another $7 million new round of grants for states and the District of Columbia. And I think that is a great, 0 to 8 focus. It's very much the integration of primary care, behavioral health, child care, home visiting, all of that, bringing all of that together and providing that flexibility for the government and the community to partner and say, how do we best serve these young kids and their parents? So that will be coming out, moving a little bit up the field. So Project Aware, that's for our school-aged youth. That's where we're taking, you've, I think, probably had a Safe Schools Healthy Students grant before, but this is taking that Safe Schools Healthy Students model to scale, to prevent violence, to reduce substance abuse, to promote mental health, prevent bullying, and increase mental health awareness, improve school climate and conditions for learning for all youth. Because we believe that if we do that early and build that into, I think you guys were talking about sort of the integrated way of building this into everything that we do, everywhere we go, sort of health in all policies, mental health in all services, that the schools working with law enforcement, working with behavioral health, working with faith-based, boys and girls clubs, everywhere where youth go, where the students go, and then with the families and the young people themselves can help to improve that school climate. And we've seen fantastic outcomes, drastic reductions in substance use, incredible ability of teachers to feel safer, for students to feel safer, but also a lot more kids getting detected who have problems and getting actually connected with services earlier in the trajectory. So that's Project Aware will also be at the state level as well as to individual, probably duplicative for you, but individual LEAs. And that's going to be paired with mental health first aid money. So mental health first aid will provide, it'll be also funding tied with to the SEA to train teachers, but other adults who work with youth. So getting out there and training the doctors, training the police, training the faith-based leaders, training the youth workers, and training the youth and training the parents. So I know you already have a robust mental health first aid program in DC, but this would build on that. And I think you've mentioned that sort of the need has outstripped your capacity, so this would be a great adjunct to that. So in addition to the state Project Aware, which gets the SEA and the locals doing the mental health first aid and the Safe Schools model, there will be separate mental health first aid grants. So one or the other, sort of right size it for what your needs are. In addition, so moving down the pike a little bit, we have Healthy Transitions, which is to engage those kids who actually have a condition, are having a mental health problem or a substance use problem, and either need to be engaged for the first time or would benefit from some kind of engagement, either them or their parents. The parents are asking me, I think your Project Access or your Access line is great to, those parents that have questions. What do we do? I'm seeing a problem. My kid doesn't get out of the basement. They're on video games all day. What should I do? Who can I talk to? And who can I talk to that's not something scary? But something approachable and accessible. And then how do we array these services? I know you have Raise DC, which is great. How do you array the right kinds of services so that we can reduce the duration of untreated psychosis, we can get kids who are experiencing problems early on and do an intervention so that we can keep these things from becoming fragile conditions, right? You don't want them to become brittle conditions. You want them to have these kids have the supported education, the supported employment, the other supports, peer supports that they need, and the family supports that they need to go on to lead successful adult lives that we know that they all can do. And you might say, well, that's great. You can have all these new programs, but who's going to work at them? well, as a matter of fact, the President's plan also, and the Congress has appropriated funding for mental and behavioral health workforce. In the biggest infusion that we have seen in many, many years. It is wonderful that in partnership with HRSA, SAMHSA will have grants to focus on training master's level professionals as well as paraprofessionals. And those will be to fund clinical placements and practica. So it's really to get those last couple of years of training so that you can get ready to go providers, because we all also know that that's a time that many community providers have a hard time. There aren't as many, I think APA and others have said there's not as many internship slots available because we can't bill for their time. So we're reducing the number of training slots. Well, this would be for those folks. It's also paraprofessionals, so community health workers, promotores, behavioral health aides, those kinds of care extenders that we know we need, as well as paraprofessionals and peer supports. I would put in a pitch, though, that in 2015 we have a proposal for a $10 million peer professionals program, which would include parents and youth. So that would expand even that particular segment of the workforce. So that's $35 million in the mental and behavioral health education and training program. Someone mentioned, I think in one of the plans talked about for the transition age youth, talking about supporting supported employment for young people. And we will also have a new supported employment grant for the first time since, I think, the mid-90s. SAMHSA will be doing a supported employment program really explicitly. So that's a great opportunity for you. Talking to some folks earlier, we know that trauma is a huge problem in all of our cities. But particularly, I know that certain schools in DC are very affected by trauma. And the Department of Education has received $10 million, which they are dedicating to Project Prevent, which is specifically to increase interventions in schools for schools that have pervasive trauma among their young people. So SAMHSA is looking forward to working with the Department of Education on that. Department of Education's also got grants for school climate and implementation of multi-tiered behavioral frameworks. And we're also working with the Department of Justice as they're trying to decrease the school-to-prison pipeline, do some intervention on that, and help identify kids who are at risk and perhaps having behavioral health problems, and train law enforcement and schools to, do, I think it's success instead of suspension, right? So how do we help not have that disproportionate minority representation in the criminal justice system, not have so many kids with mental health and substance use problems getting into juvenile justice, but instead get them into the right services and supports that can help change the trajectory for life. So there are, as you can see, many, many programs. There are other programs that I could keep talking about, and I'm happy to do so if others have questions. But in general, I want to say that this DC really is, what you guys have done is the model. This is what we were hoping was going to happen, that you would galvanize, you would get your community leaders, you would get your community members. You would engage in that conversation with the youth and their parents. What do you need? What makes sense? And then you would have your policy leaders coming around the table saying, how do we make this solution that makes sense happen? That's fantastic, and I feel like that's what we've tried to do. It's what the president and the vice president have tried to do at the federal level. We've said, we think we have heard from communities, from young people, from schools, from leaders of what they need, and so we have tried to array our programs in a similar fashion so that, as you can see, they fit in such a nice way with what you guys have identified as priorities. So congratulations. I think together, working together, we can make a huge difference for the young people in Washington, D.C.
I have this feeling we should quit while we're ahead. I want to thank Dr. Inamoto for coming and being with us today. I was with her, 4 or 5 weeks ago with the U.S. Conference of Mayors. And it really was delightful to be in a group where you get an opportunity to compare what you're doing. And I really do feel that we're on the right track with this. I listened very intently to the various and sundry grant programs that are going to be available, and I can assure you we will be standing at your doorstep. There's one other, Medicaid has been mentioned in here a number of times, and we have one of the most generous and wide-ranging Medicaid programs here in the district, in the nation, because every Medicaid program, for the most part, is tailored to the needs and wishes of a respective jurisdiction. There's certain mandatory services that you have to provide, but then there's a lot of provisional services, or optional services, I guess we'd call them, that are available too. And one of the least known options available is the EPSDT program, the Early Periodic Screening, Diagnosis, and Treatment Program, which really has extraordinary relevance to what we're doing today. The Medicaid program, frankly, is the largest insurance program in the District of Columbia. And it is an option that we may need to use even more extensively, especially to be able to put to work the plans that we saw today. The one thing I would caution us is that let's remember this, that a plan is not a completion point, it is a beginning point. And we need to take what we saw today, work as a team, let's move forward to get this done. I appreciate you acknowledging that we are in the forefront, and that's where we plan to stay. And we can only feel good about that when we see that we're increasing the numbers of youth who talk about mental health and not mental illness. And I'm not shaking my head. I'm supporting mental health.